With lymphatic drainage, I always instruct the patient like what I'm doing, and typically, they're in a gown and draped for this type of technique. But you have to think about the lymphatic system is over your entire body, and we have to clear out the lymphatic system before we push more fluid up to it. So we actually start out with deep breathing techniques and then clearing out the deep vessels like in the neck area before we send fluid that way. So I usually tell my patient to go ahead and take a couple of deep breaths. Okay. And then I spend a couple of minutes up at the neck just trying to warm those deep lymphatic vessels up. And we always try to do skin to skin contact to get the best type of strokes. Okay, and then with her, because her right arm is affected, I can come around to the left side and warm this group of lymph nodes up so we can send some fluid across her chest. It's a very light massage and light technique. In the area where the lymph nodes are, it's a little bit deeper because the lymph nodes are deeper, but the lymphatic vessels are very superficial and just right underneath the skin. So once I've done that, I can come back around and we call across the chest creating like a road, or we call it in therapy an anastomosis, and that's just a connection between vessels. And so what we're trying to do is, because lymphatic flow doesn't typically go across the body like that, what we're doing with the massage is trying to redirect the flow. Because her right axillary lymph nodes have been removed, we're trying to figure out other ways for this fluid to get out. So once I've spent a few minutes on the chest and warming up all the central lymphatic vessels, then I can actually move into the swollen limb. And you always start proximal, which is close to the head, because remember we have to clear out what's up here first before we send fluid to the proximal vessels. And all of the therapists are different, and they may develop their own ways of doing things, but there's several different types of strokes that you can use. But the key is that you're hitting all sections of the arm, and that I'm always pushing towards the head. And so I just usually spend several minutes on each section of the arm. There's several ways of doing this. Sometimes I'll have patients flip to their sides and I'll try to drain across the back as well. So we can create that connection across the back as well as in front of the chest. Just depends on how the patient responds to the treatment. Some people, they don't feel comfortable on their stomachs. So I've done it, laying on their sides. Okay. Once I feel like I've fully covered an area, which I would spend a few more minutes on that, then I can move down to the elbow. And we do have some lymph nodes in our elbow bend, so that technique is a little bit deeper. Another reason that my massage technique would be deeper is if I felt like she had some fluid that had hardened or become fibrotic, because I want to try and soften that up before we do the wraps, because the wraps can push it out better if it's soft. And I would spend time on both sides of the elbow. Okay, and then I usually sit to do the forearm and the hand. And it's the same thing, you know, you're trying to clear out the proximal area before you move down. So everything I'm doing, I'm trying to just stretch this skin and giving these lymphatic vessels just a little bit of a nudge and kind of show them where to go. And so after I'd done that for several minutes, I would move down to the wrist. I usually do about 7 to 8 strokes in each area. If I felt like it needed, you know, more attention, I could always stop and do more or go back. And then we could flip the arm, do the back side of the hand. I'll do several strokes there. And then with each finger, I'll do several. And I'll do that on each finger, and then I would make my way back up the arm and spend time as needed. You know, these are follow-up moves, so if her hand was my main concern, I may spend a little bit more time there than the upper arm. And I also try to get, you know, the back side of the arm. But there's several different ways you can do this, as long as the direction of the push is following the anatomy of the lymphatic system. But I would slowly make my way back up. And once I got back up, I would just reinforce that anastomosis, or the connection that I made across the chest. And I would do that 5 to 6 times before I finished up. So basically, we're just trying to give the fluid other options. You know, our body is so used to draining this lymphatic fluid in one way, which is okay until you have lymph nodes removed and that bridges out. So we have to teach it other ways. And like I said, there's multiple ways to do this, you know, across the chest. We could try to drain down to the inguinal lymph nodes in the leg. We can create, you know, a connection there. So there's just several ways that you can do it, and you just try to tailor it to your patient.